Okay, we're going to do an amalgam today on Mr. Typodont. And we're going to do tooth number 5. It's going to be a DO, so we're going to place topical up in the vestibule. We're going to let the topical sit there usually for a minute or two. Then we are going to do an infiltration on tooth number 5. So we're going to go right in the vestibule and inject right above the tooth root or in the nerve. Use our aspirating syringe so we can make sure we're not in the blood vessel. And aspirate and then continue on. Okay. We're going to give them a good rinse so that they don't get that nasty flavor in their mouth. Alright, it only on the upper maxillary arch, it usually takes a minute or so for it to take a hold. We're going to check everything out. Make sure that we know what we're doing. Make sure we're doing the right tooth. Okay. Alright, let's prepare the tooth for our amalgam. I'm going to remove the filling that's in there. And we're going to suction. And when you pick up your suction, you're going to always have your air water syringe with you. We're working on tooth number 5. I need a mirror, so you're going to rinse my mirror while we're removing the filling. Okay, water or air on the mirror. Okay. There, keep going. There we go. So we're removing the filling. The assistant's going to keep my mirror nice and dry because this is my only eyes I have right now. Okay, go ahead and suck dry. Okay, and dry. Okay. Okay. And we'll continue on. Go ahead and rinse and dry. Alright, we've got all the filling material out. Now we need to remove the decay. So we're going to use our latch round. I'm going to use about a 4 round. And I'm going to remove some decay, a lot of vibration. The slow speed hand piece goes a lot slower, makes it easier to remove the decay in a controlled manner, so you're not taking too much of the tooth structure, just the decay that needs to come out. Okay, rinse and dry. Alright, we do need a little bit of die-cal because it's deep. So we're going to place some die-cal. The assistant will put 2 tiny little drops, one of base and one of catalyst. And then you're going to use the die-cal instrument actually to mix your die-cal, because it's such a small little area, a small portion of material, that if you use a spatula, you're going to end up, I want to clean, you're going to end up taking too much material off of your pad. So we're going to use the die-cal instrument. Use a mirror, I want just a little tiny bit. The doctor's going to place the die-cal in the area that's necessary, only on the area that's exposed or close. The die-cal does not go all over the base of the tooth. Okay. All right, now we're going to place the Toffemire and a band.